Hello YouTubers, how are you doing? How are you feeling? Let me know in the comments below. May is Lyme Disease Awareness Month, so I'm doing my best to make sure you're all aware and well protected. If you missed it last week, make sure to check out that video on how to protect yourself, your family, your yard from bug bites. This week I am sharing a little bit about the controversies surrounding Lyme disease treatment. Now I could go on all day. There's multiple different books about the controversies surrounding Lyme disease treatment, but I'm just going to share what I believe is most important for Lyme patients who are trying to heal. When caught early enough, the bacteria that causes Lyme disease, Borrelia burgdorferi, can get wiped out by one simple course of antibiotics. However, due to its stealthy nature and defensive mechanisms, once this bacteria is disseminated and spread throughout the body, many Lyme patients are failing these standard Lyme treatments. Despite thousands of peer-reviewed studies showing these high treatment failures, the CDC and the Infectious Disease Society of America has stated that Lyme disease is easy to treat and has created these very strict treatment protocols. So Lyme patients are currently prescribed 1 day to 28 days of antibiotic therapy for Lyme disease, which does not take into account how long a patient has been sick or any of the co-infections or complications that could come along with this illness. The CDC's protocol states that if a Lyme patient goes through this treatment and fails and continues to have symptoms, they're now given a new diagnosis and told that they have post-treatment Lyme disease syndrome, also known as PTLDS. The CDC and the IDSA have very little to say about this PTLDS. I really tried to dig in and find where this term first came from, who created the term, when was the first case diagnosed. Couldn't find any of that information. There's no medical billing code for PTLDS. There's no treatment suggested for this illness either, and there's very few federally funded research projects being done. And the only treatment that the CDC mentions is time and symptom management at the discretion of your doctor. So I'll just go ahead and read this quote here. Patients with PTLDS usually get better over time, but it can take many months to feel completely well. If you have been treated for Lyme disease and still feel unwell, see your healthcare provider to discuss additional options for managing your symptoms. So we're just kind of leaving our Lyme patients high and dry after this 28-day mark. If your doctor continues to treat you outside of these CDC protocols, they may be held for unprofessional conduct, and they can actually be sued by insurance companies. Many Lyme treating physicians have actually gone bankrupt and lost their medical licenses due to treating outside of the CDC guidelines. With high treatment failure rates and harsh penalties, you can imagine why many doctors would be reluctant to treat Lyme disease. I personally had to call over 35 doctors on my insurance list before one would see me with my positive Western blot test back in 2015. Lyme advocacy groups, scientists, and doctors from all over the world disagree with how the CDC handles Lyme disease and the description of post-treatment Lyme disease syndrome. A recent study done on chronic Lyme patients found measurable and widespread brain inflammation, which may indicate that post-treatment Lyme disease syndrome is caused by a persistent infection. The International Lyme and Associated Disease Society has created a training program for physicians to become aware of all these complications. And I'll just read you a quote from their website. Many patients with early Lyme have been treated with short courses of antibiotics, less than 20 days, and recovered. However, both in practice and in the scientific literature, it has been observed that a significant number of patients do not return to their pre-Lyme health with short courses of antibiotics. The ILADS Guidelines Working Group reviewed the available research and developed recommendations based upon the best available evidence, clinical expertise, and patient-centered values. Due to the controversies surrounding Lyme disease treatment, finding a Lyme specialist known as Lyme literate physician early on is critical to proper care. A Lyme literate physician, or LLMD, is a physician who has gone through the ILADS, International Lyme and Associated Diseases Society's training program. This is a 2-week-long program to get physicians in the know of all the controversies and complications that go along with Lyme treatment. If you're looking for a Lyme specialist, you can go onto the ILADS website at ilads.org and type in your information, and they're going to send you 3 randomly selected doctors in your area. It could take a few hours or a few days, or in my case, it took a few weeks to get those referral names. So in the meantime, while you're waiting, you can go onto Facebook and look for a Lyme support group in your area. People in the Lyme support groups have been through it, and they're going to be able to give you more information about those doctors and tell you who they like, who they don't like, and hopefully save you a lot of time and money. Don't forget that these Lyme literate physicians have only gone through a 2-week training course. They do not have all the answers, so don't be afraid to reach out to multiple different doctors and find the best care for your unique needs. I found that each doctor could only get me so far, and I've used multiple doctors. All right, everybody, that's all I've got for you today, so please hit that thumbs up button if you learned something today, and the subscribe down below. It helps more people find my videos, and reach out with any questions. Let me know what you want to learn more about below, and I will see you next Thursday. My name is Jen Hyla. I am a speaker, author, Lyme advocate, and recovery coach. Keep healing. Bye.